Welcome to The Whole View. I'm Stacy Toth of Real Everything, and I'm here each week to dive deeper into how we can find happiness and health inside and out through self love, body positivity, and finding new ways to be our best selves. Before we get started, a reminder this podcast is for general educational purposes and is not intended to diagnose, advise, or treat any physical or mental illness. And while our guest today, Dr. Levitt, is a doctor, he's not your doctor. So we always recommend that you see a licensed health professional accordingly. That said, I do want to welcome Dr. Levitt to the show, who has a very unique approach, informed by an education that included a degree in physiology. I always have such a hard time with the PHYS words and how there's like where the pronunciation is supposed to be, but I'm pretty sure I got that one
You
from
nailed it. You
UC.
nailed it.
It's like every time I see it, I'm like, wait, which of these words is it?
Is it
Um,
psychology? Is it physiology? They're so close. Yeah, we can
yeah.
talk about that later. But you nailed it. You nailed it that time.
From UCLA and a doctorate in naturopathic medicine from Bastyr University. Is that how you pronounce that one as
You
well?
nailed that one too. You're 2 for 2 so
Two for
far.
two. Formal residency training in integrative medicine in Seattle and over 15 years of direct clinical experience with thousands of patients. And in that practice, Dr. Levitt draws upon both the science of conventional and natural medicine, combining the two into a best of both worlds approach. And he employs a unique blend of nutritional therapy, herbal medicine, and physical medicine to treat a wide range of common and complex medical problems. His patients praise him for the ability to educate, motivate, and inspire with stories and guidance. And as someone who has been on his social media, I totally get that. I was a little bit of a stalker before we get the show started today. And at his private practice in Connecticut, he is also a clinical preceptor for the Yale School of Medicine, which I have no idea what that means, but I'm looking forward to hearing about it. Dr. Levitt is also the author of several books, as well as educational articles and videos. As I mentioned, he is on Instagram and TikTok at Dr. Josh Levitt, and you can also find his website and all of the other things that he's about at wellness.com. I want to thank you so much for being here today. Could you tell listeners a little bit more about kind of who you really are? Hopefully, I've covered the formal bio, but
Right. You covered the formal, embarrassing, written in the third person kind of bio for sure. Yeah, I'm happy to. You want to hear kind of like the origin story?
yeah, whatever you want to share us, just so listeners can get a better feel for, a little bit about yourself and what you're about.
Yeah, absolutely. I mean, first of all, I'm a human just like everybody else, right? I'm here in my little home-based podcast studio. My wife, my 3 teenagers, my dog are all here. Yes, we have a clinical practice just a few minutes up the road from here. Down the road is Yale University, where you asked about the clinical preceptorship. So that basically means bringing students of medicine, in this case, residents of medicine in the internal medicine slash pediatrics program at Yale through the office in a clinical kind of rotation. And yeah, my life for the last 25 plus years has been just heavily devoted to the practice of naturopathic medicine, which has evolved a lot over those years from kind of like a really alternative medical field, which is sort of what it was when I got into it. My parents being pretty conventionally oriented, including conventional doctors in the mix there, thinking like, what the heck kind of a career is this? Alternative medicine, how are you ever going to make a living? To now, it being, gosh, like almost mainstream and health and wellness taking over and being a multi-billion-dollar industry and biohacking and all this stuff is kind of been a fun and very interesting ride. Like you said, my journey, I'll just give you the brief origin story, started at UCLA. I always thought I was going to be a conventional doctor, just kind of one of those kids who always wanted to be a doctor. But I had kind of backstage access to physicians at UCLA because of my dad's job at the time, training medical residents there. And it became clear to me from conversations with them that medicine was going in a different direction, right? Like it wasn't what it used to be, so to speak, the increasing influence of insurance companies, increasing influence of big pharma, all these sort of factors that were having them tell me, going into medicine, maybe not the best idea. So long story short, I took off for a year and I traveled around the world kind of in one of those soul seeking, searching kind of ways. And during that trip, I got sick with this problem called cellulitis, which is a superficial but spreading skin infection that was related to me, like wearing sandals and sleeping on beaches and living out of youth hostels and stuff. And I was in Switzerland at the time. I needed antibiotics desperately. It was a very bad, like limb threatening kind of infection. I got the antibiotics at a Swiss pharmacy. And when I went in there, I not only got the antibiotics that I needed that cured the problem, but also exposed me. I don't know if you've ever been to a European pharmacy. It's full of herbal medicine stuff, nutritional medicine stuff. And I was just tripped out by that. I'd never seen anything like that. And it lit this passion in me and this interest that is just still burning strong now. So it's a funny irony because I'm a naturopathic doctor, right? But I got my start on the day that I needed antibiotics. And so it's a sort of a funny irony. Here I am 25 years later, still practicing, still educating, formulating products. Yeah, it's my world.
I think that's a fascinating story that also tells a lot about the juxtaposition in how you approach. I do want to kind of swallow the frog, so to speak, and address most difficult part of the discussion. I have had a real challenge wrestling how I feel naturopathic medicine, holistic wellness, general natural approaches because I have found in the, almost 15 years that I've been doing this, I was perpetuating concepts of healthism, of ableism, of fat phobia, and systems of oppression for those marginalized people and groups who don't have access to the resources that I was often recommending and that are often found in the community. And we spoke a little bit before we got started as a foster parent and going through and seeing more about the full breadth of what struggles people have in the real world outside of my personalized and very privileged bubble. It kind of opened me up to, okay, how do I take all of this information and knowledge that I now have and use that? Because the information is still relevant. It's still accurate that these things can be very helpful, yet can solutions be inclusive? Can we find ways to explore how everyone can have access to some of the tools that we know are helpful beyond conventional medicine? So I'm kind of curious if this is something that you're familiar with, have thoughts on, have seen as you've been doing this for 25 years progress. Like, where are you with that thought process?
Yeah, wow, Stacy, that's amazing, and, yeah, we're jumping right in, swallowing the frog, right? Eat the frog, do the hard
Yep.
stuff first, but this is super important, and yes, I'm familiar with it. Yes, I've wrestled with it myself, both personally and professionally, and I think you're spot on, and the crazy thing about it, I mean, just to start this conversation, because we could really go deep here, is that natural medicine in its true kind of form ought to be the medicine for everyone, right? Like, I mean, that this is what we're talking about, the medicine from the earth, the foods, the herbal medicines. These should not be the medicines that are exclusive to people who have money, to people who have power, to people who have privilege, right? Like, I mean, this is the medicine for the people. And like, that's sort of what I was referring to actually in a way, watching that evolution over the last 25 years of my career in the field, seeing this kind of pure natural medicine, this very earthy, down to earth kind of practice become the purview of like Instagram influencers and biohackers and functional medicine practices that charge people $1,500 an hour to get access to natural medicine. I mean, where are we going? Right. And that is a sad state of affairs indeed. You mentioned healthism, which I think is a really interesting one. I'm not sure that you certainly do, and I suspect that a lot of your audience does too, sort of understand what that means. And it's super, super important. And I think it's a major slippery slope in natural medicine. Let me just define it for those of you who aren't familiar with the term, at least by my definition. Correct me if I'm wrong. But like the idea of healthism is that someone's health is their own pure and total responsibility, right? That if something is going wrong in one's health, then you are doing something wrong, right? Not eating right, not exercising enough. Healthism is like, if something's not right, then it's your fault, right? And
I
am
would
I on
add,
track with that?
yes, absolutely. And I would add to that that it's somehow defined to their worth. That as part of society, if so, for example, my story is, I originally lost over 100 pounds, like did all this work within my family who's very neurodiverse to find things that helped us optimize our lives to live healthier lives. And I felt for a very long time that made me better, like better than who I was before that. But also, if I'm being honest, better than those people who were not willing to make the sacrifices that I made to, have the lifestyle and blah, blah, blah. And I think, when I think of healthism, I think very much of that. Like, yes, that lifestyle stuff helped, but it didn't make me a better person than someone else who isn't
Yeah.
doing that.
Yeah. And, yeah, I totally agree. Yeah, the to piggyback on top of that, are you familiar with Bernie Siegel back in the day? Bernie Siegel, famous author. He was a Yale guy, pediatric oncologist. It's really relevant to our discussion here. Powerful, I think, example of this on the medical side. So he was a pediatric oncologist. He was famous for shaving his head in solidarity with his pediatric cancer patients back in the day. And he wrote some very beautiful and important books with titles like Love, Medicine, and Miracles was one of the most famous ones. And Bernie was a great guy and big mover and shaker in the field of a more, I don't know, gentle, natural form of conventional medicine. But he was also criticized, and he was criticized for this kind of healthism thing, which has to do with this, right? If indeed, part of a treatment plan is love or prayer or these sorts of things, then especially in pediatric cancer patients, but in anyone, right? Anyone with any sort of medical problem, mental, physical, or otherwise, if we believe or are inclined to believe that love or prayer or meditation or exercise or diet or any of these wonderful things are part of the treatment plan, then if the treatment plan doesn't go well, which often is the case in pediatric cancer or in other diseases, I'm a physician, we see bad stuff all the time. It's easy for the patient to believe that they didn't love enough, that they didn't pray enough, or that they didn't meditate properly, or eat properly, or exercise enough, or whatever the case may be. And that is a very dangerous and slippery slope, in my opinion.
I'm glad you brought that up. I wasn't familiar with his work, but I resonate a lot with that example. I remember being on book tours and talking to people. I authored 3 paleo cookbooks and have autoimmune diseases and different kinds of things that were helped tremendously by making lifestyle changes. And I would talk to people who would just be in tears and say, I'm doing everything exactly the way I'm supposed to be doing, and I'm not fixed.
Yeah,
I'm not.
yeah,
And it comes from a place of, first of all, feeling broken, which is sad, right? Like, it's also just heartbreaking to see that someone takes, when we feel personally accountable instead of just empowered with the information, then I think that it can also feel like we're a failure, we're broken, we're these things if it doesn't work. And I think, what I love about the work that you do is that you pair it with conventional medicine. And it's okay to also say, if you're doing the things that we know from, experience and from science can often help people and it's not helping you, it's okay to also like reach out and use some of these other tools that are available, which is definitely what I want to talk more about today because I do think that is a place where it's like a niche I find that has to be where we go, yet is not popular because it's not clickbaity on the internet,
mhm,
not compelling for people to be like, moderation doesn't sell the way that like the extremes of one or the other convince people this is going to be the thing. So
yeah.
I'm just wondering if you're kind of ready to move on from that. I know I opened the can of worms. Are we ready to put a lid on it and talk a little bit more? Or did you have other thoughts come up?
Oh, I mean, we can certainly put a lid
Yeah,
on
I
it, but I think the lid's gonna be, like, permeable, right? And it's gonna,
Yeah.
like, infuse our conversation because that conversation about inclusivity and access and all that stuff is very important, and we could go on and on about that. So I'm happy to go on there, but also to let it just permeate or infuse the rest of our conversation. I do wanna just acknowledge because I've said it so many times just in the clinical practice setting where, of course, you know, eating well, nutrition, physical activity, lifestyle management, all those things are important tools in the toolkit of a naturopathic doctor like me. But I can't tell you how many times I've told a person, "Look, you didn't eat your way into this problem, and you're not gonna eat your way out of it either." And that doesn't mean that nutrition's not important, right? Diet is important. I want you to eat the right things that try to maximize your potential, right? But there are things in health and medicine world that happen independent of the choices that you make, genetic and all sorts of other things that can influence that. And it's a very it's a dangerous proposition to put all of that responsibility on a patient. And I can't tell you like how many times people have felt such relief at hearing such a simple statement like this. Like, no, you didn't eat your way into this. This just happens. And sometimes bad stuff happens. And we need to, I sometimes use the metaphor of like we're playing cards, like we're playing poker or whatever. And sometimes you get a bad hand. And like that's a bummer when that happens, but you play on, you do the best you can. Sometimes you win, sometimes you lose. And when a person comes in with a diagnosis that is, serious or chronic or whatever the case may be. Some people get dealt a bad hand. And then our job at that point is to play it the best way that we can, you know? And so, yeah, we can certainly move on into more practical things, but let's let it infuse the rest of the conversation for sure.
Yeah, absolutely. And also, hopefully, listeners can take, a sigh of relief and knowing it's not because you didn't, do the thing well enough, or, we used to joke, it's not about paleoing hard enough. Like if you're doing all the things, feel really good about that. And then also know that there are other tools available to you. So let's
Yeah,
talk
and
about,
there's one other thing that I would just add in, and then I promise, right? We'll move into the details. And that is this interesting phenomenon that like I think people conflate a lot the 2 areas of like what we're calling health and wellness, and then this thing called natural medicine. And to me, they're sort of distinct, right? Like health and wellness, I think of it really, and I'm in that space, but I think of it as kind of like this Instagram version of reality, right? This optimization and doing fancy and expensive functional laboratory testing and eating according to these various dietary patterns and getting into the details of which type of magnesium is most appropriate, all that kind of stuff. It's like high level functional medicine stuff, often aimed at optimizing performance or optimizing longevity or even just optimizing for prevention. And in my real world clinical practice, it's very rare for somebody to come in and say, "Hey, doc, like I'm doing awesome and I want you to help me be more awesome." That's just not usually what people come in
if
for, you
only.
know? Yeah, right? Like, I mean, that would be amazing. That'd be so easy, right? But instead, they come in with thyroid diseases and diabetes and like late stage arthritis and other autoimmune diseases and cancer and whatever other thing, And though people are motivated by pain, they're motivated by suffering. And so when I think of natural medicine, I think of medicine. This is clinical practice, people who are sick and they're suffering in some kind of way. And that's a lot different than a person's like, my biceps are 18 inches and I want to get them to 20, or whatever, right? Like for bodybuilding, those are two very different and distinct fields in my mind anyway. So I think there's a lot of
Yeah.
people conflate those two a lot.
Yeah. I think the other thing that I think of is all the people who have tried the basic things that you're talking about and it doesn't work for them. And so instead of feeling like, okay, and now I'm going to add in, so in my case, I added in anti-anxiety medication because I'm a control freak and I, have perfectionist tendencies. And while I'm working with all of that in therapy and different kinds of things, I also recognize that anxiety was causing a lot of the symptoms that I was experiencing. And so I think the hard thing as a human is to kind of admit I can't control something and I need help from something else. And so, being at that flux point, a lot of people feel like what I'm doing isn't working. So I need to do it more. I need to do it better. It's not that I'm not taking the magnesium, it's that I'm not taking the right kind of magnesium or enough magnesium. And as someone who is deficient in magnesium from my stress and everything else, I have played with multiple magnesiums and looking at, how much is my body absorbing and all those kinds of things. And I also recognize the privilege in being able to do that, right? And
Yeah.
being able to set that aside.
It sounds to me like you took it in a stepwise fashion, much the way that I would describe anybody approach any medical problem, especially one that's of a chronic and not emergent type of nature, is like approach it with those, I would call them low order, low force interventions first. Those are things like modifying the diet, modifying the lifestyle to the extent that you're able, exploring herbal or nutritional medicines, amino acid therapies, minerals like magnesium, and then moving up the line and understanding that like a therapeutic approach or an intervention is it often is like a ladder, and that we describe it as such in naturopathic medicine. We call it a hierarchy of therapeutics, starting with the low force interventions, the ones I just mentioned, and then moving up the line or up the stairs of the ladder from there, recognizing that it's a little more perilous as you get higher, right? Like it's perfectly okay to acknowledge that stepping into the medication realm or into the surgery realm is a little bit more perilous, a little bit more forceful, potentially a little bit more toxic. But sometimes, to get those upper levels, if you're painting a house or something, you need to get up on those higher rungs. And that's perfectly okay. I think where we go wrong a lot of times in medicine is that, in conventional medicine anyway, is that we go to those top rungs so quickly without ever acknowledging the ones below. And if we keep it stepwise, I don't see any reason why pharmaceutical interventions or even surgical interventions can't be part of the algorithm, right? They ought to be. There are times when a person needs a surgery. There are times when a person should think of that medicine as a blessing, not a curse, and certainly not a failure. So that's where I'm at. That's how I've always practiced. And it sounds like we're cut from the same cloth in that regard.
Yes, and hopefully, I think our listeners will identify a lot with that because I've tried to take them along that journey. And I think it's where you offer something really unique in what you share with your audience on social and different kinds of things. And so, one of the stories that you shared on Instagram, because I am the mother of 4 teenagers, I am on Instagram, not TikTok, was about the Movo, which I hadn't heard of before as being a new medicine that came out that was essentially 2 over-the-counter drugs combined into a prescription, which is then ridiculously expensive. And as you were talking, I was like, "Yep, sounds about right." I'm wondering if there are other examples like that that we can be aware of when we're talking about access and inclusivity. This is an area where I think people can be empowered to have information and utilize it for their own benefit.
Yeah, totally. That video in the terms of the Instagram world, it popped off, right? People really like that. I wouldn't say that it totally went viral, but people appreciate the sentiment and people can relate to it just in the way that you did. Yeah, Vimovo is this drug that's a combination of naproxen, which is Aleve, it's an anti-inflammatory drug that's commonly used over the counter, and a proton pump inhibitor called Nexium, omeprazole. So those two drugs combined. Now, Aleve, the naproxen part, is harsh on the stomach. And so as a result of that, a lot of people will wind up getting gastrointestinal problems. And then having acid in your stomach, which is normal, natural, and important for our digestive health and our overall health, having acid in your stomach when you're taking a drug that kind of burns or irritates your stomach kind of like adds fuel to the fire and can maybe burn people even worse. And so the idea is suppress the stomach acid with an acid blocking drug, in this case, Nexium, which there's a whole bunch of pitfalls related to that. I don't think that's the right approach anyway. But the idea is if you're going to take a drug that damages your stomach, having acid in your stomach is going to possibly make that even worse. So let's use another drug to suppress the acid. And then Big Pharma comes up with the idea, let's just take those two drugs, combine them together into one pill, and then sell that pill at massive markups over what those generic pharmaceuticals would cost. That's what Vimovo is. And to your question, yeah, there's a whole bunch of these different drugs. There's dozens of them in virtually every category where we've taken either branded or generic pharmaceuticals and combined them. I can give you just like a few examples that you might have heard of. One of them that I know everyone's heard of is Percocet. Percocet's oxycodone and Tylenol. It's a combination pharmaceutical. Zegerid is another one that's Nexium with sodium bicarbonate, like with Tums. There's a whole bunch of these in cardiovascular medicine that are combinations of like a diuretic and a calcium channel blocker, 2 different blood pressure pills, a statin with a blood pressure medicine, ibuprofen with another acid blocking drug. So there's tons of these things. And actually, before we signed on this morning, I did a little bit of background on this, just figuring this would be kind of a line of inquiry here. And it turns out there was a study about this, like it talk about, the gross misuse of funds in American healthcare. There was a study published in JAMA in 2018. So 5 years old now. We can assume the numbers are even increased from here. There's dozens of these different drugs and Medicare pays for them, right? So they're covered by insurance, many of these things. So these researchers did this homework of like, how much more is Medicare paying for these combination drugs than they would pay if they just used the drugs like by themselves together, right? Like buy the Aleve and buy the Nexium and put them together. The answer, $925 million per year, right? This is like a $1 billion enterprise, and Medicare, which is AKA your and my tax dollars, is paying for it, right? So I have no doubt and every reason to believe those numbers are increased from now. So we're talking about $1 billion excess spending just on drugs that are combined into a single pill for the purposes of convenience. Sure, they're a little more convenient, but I mean, come on. That's ridiculous, in my opinion.
And it's overinflated. It's not like an actual cost either, right? It's that they're charging more for something by being able to brand it and not have it be generic for the use of the licensure. I don't even understand all the medical stuff, but I do know that they have a period of time where someone can't make a generic version of that. So it's almost like sometimes pharmaceutical brands are coming up with ways to rebrand and re-come up medicine in order to have it not be in a competitive field.
Yeah, it's just intellectual property law, right? It's patent law. So like they tweak a molecule or do some little manipulation, like add another drug to it. And now all of a sudden you have patent rights that extend for 10 years, in some cases 15, during which time only you, the company that is, can sell that particular pharmaceutical, which usually means billions of dollars in added profits from just a small tweak. And so, yeah, absolutely. It's just a big money game. It's a big intellectual property and patent law game for sure.
Here's an interesting story for you, given that I probably have personal experience of others might not. So I have a child who is on Medicare because their guardian is the state, and they needed a prescription for a medicine that was a little bit different than the generic version. Like the chemical makeup was a little bit different, and they needed the one that was a little bit different for a specific reason. And we tried for months to get medical approval, like justification from the doctor as to why that one needed to be, and we couldn't get the generic and all this kind of stuff. And because they're going through Medicare, it's like this whole thing to have the legal guardian, who's a third party, sign forms and then pay out of pocket and get reimbursed. It was a nightmare that we ended up just like talking to their medical doctor and being like, what is a different thing that we can do? Because this is impossible. And it was costing, in our case, at least it was hundreds of dollars a month and not thousands of dollars a month. But to the average person who has public health care of some kind, Medicare, Medicaid, anything like that, the impossibility of being able to do something like that, right? To fight it. And that the doctor was like, no, literally, this is the one that they need. Like the generic one was causing problems to their symptoms. And it was like, this one is a little bit different and this is the one they need. And still, the insurance is the people who got to make the decision about what
Yeah.
the patient needed, right?
It's a
Like
crazy, it's just crazy. It's a tragedy, a similar but different experience very personally. I live here in Connecticut and I'm an avid outside person and I've gotten Lyme disease a few times. I'm sure you've heard of it. And so Lyme disease is best treated. This is a could be controversial, but like I think when people get Lyme disease, especially acutely like I did, they need to take antibiotics. And the antibiotic of choice is
I
a
thought,
drug.
I thought you were going to say not take antibiotics. And I was like, that would have been controversial.
Yeah,
Like, if you have acute Lyme disease, please take medicine.
yeah. Okay, yeah. So yeah, in my world, what I just said may be controversial. So hopefully we won't get too much hate mail after this. But yeah, the drug of choice is doxycycline. I had a prescription for doxycycline called into the pharmacy. The prescription said, all the various elements of the dose and whatnot, and it said, how many capsules were to be in the bottle, which was a month supply, 60 caps. And it said caps. And so they gave me the prescription when I picked it up at the pharmacy, and it was capsules of doxycycline. And it was like hundreds of dollars. Right. And I'm like, what the heck? I mean, listen, I'm in a privileged position. If I have to pay for it, I'll pay for it. But like a couple $100 for a 30-day supply of a generic old pharmaceutical seems pretty high. So I kind of pushed back and asked the question, and they said, I said, is there any alternative? And they said, there's tablets as opposed to the capsules, a little pressed tablet as opposed to the powder inside of a capsule. I'm like, how much are those? And those were like $9, right? And I was like, then I want the tablets. I mean, like, I don't think there's any difference, right? But the prescription said CAPS, CAPS. So I would have to call the doctor and be like, can you change the CAPS to TABS, tabs? And now I can get the tablets for $9 and save myself like $200, on this prescription. I'm like, what the heck kind of a system is this?
Agreed. Which also takes us into another topic that I want to discuss, which is that when we do take medicine, which can be lifesavers, I have multiple people in my house. I mentioned I'm on medicine, right? Who are on medicine. You mentioned taking antibiotics yourself, like, oh my gosh, you took medicine. But when I think of antibiotics, the first thing I think of to pair that with a more lifestyle type approach is to add in probiotic rich foods, to double up my probiotic that I take every day, right? If I'm going to take antibiotics, I'm going to repopulate as much happy bacteria while I'm killing off all the bad stuff. And I know you also had a video where you talked about prednisone, like if someone needs that because it can be life saving, also be aware that it can be depleting of some nutrients and looking into taking supplements from some of those nutrients that it might be depleting. Can we talk a little bit about what are common medicines that you talk with patients about or that you see come up that can be like, oh, if I know someone is taking this kind of medicine, then I'm going to automatically tell them, make sure you're doing these kinds of things to support yourself as well.
Yeah, 100%. Absolutely. And it's really an important area. And if you look out there or do any kind of internet searching for like drug nutrient interactions or like drug herb interactions, almost all of the information that you'll find out there is about it being bad, right? That like if you take this drug with this other herb or with this nutrient or something like that, something bad could happen. Like, don't take grapefruit juice while you're taking a statin. It's like it's almost universal that the idea of interactive substances are bad, which it turns out is not true. There are times where taking medications and taking nutrients can be synergistic or positive, especially, and you alluded to this, in the case of drug nutrient depletions, which are exceedingly common. I mean, there's large scale databases that are easily searchable of which nutrients, usually minerals and vitamins, are depleted by certain pharmaceuticals. This is well known information. And so, like, if you're taking, you use the case of an antibiotic, a probiotic isn't exactly a nutrient, but same kind of idea. You take an antibiotic, it's likely to cause some damage to the microbiome, the healthy critters that live inside and on top of you. We have trillions of microorganisms that benefit us. Many of them get killed by antibiotics. So it's a good idea to try to hold that ground while you're on an antibiotic. By the way, a little nuance here. A lot of the probiotics get killed by the antibiotics too, right? So like it's kind of a tricky area. And here's a little pro tip. There's an organism that's called Saccharomyces boulardii. We call it Sacro B for short. And it's actually a yeast. And that yeast organism does not get killed by antibiotics because antibiotics kill bacteria, not fungal organisms. And this particular yeast, Sacro B, is very useful to take while a person is on antibiotics and for some time after to hold that ground, to hold that gastrointestinal microbiological ground so that when the antibiotic is discontinued, the normal organisms can repopulate. It's a non-colonizing probiotic. I could go on and on about Sacro B, but pro tip for your listeners there, if you need to take antibiotics for whatever reason, including Saccharomyces boulardii, along with the probiotic rich foods and even, a supplemental probiotic can be very useful for decreasing the risks associated with antibiotics. So that's one example. And there are many more. You want to talk about some of the other common drugs?
Yeah, absolutely. I was fascinated by the prednisone video that you did. I'm curious what other ones are common medicine people are taking that can be depleting.
Yeah, for sure. There's a ton of them. Let's start with statins. Statins are commonly used to lower cholesterol, and that's another whole discussion that we can get into as well. And they're well known to deplete this substance called coenzyme Q10. Statins, the long name, the fancy medical name for them is HMG-CoA reductase inhibitors. That's what they do. HMG-CoA reductase is a little factory inside your liver, and it manufactures LDL cholesterol. And so when you turn off that factory with an HMG-CoA reductase inhibitor, which is what a statin is, that factory stops producing LDL cholesterol. So one of the effects of statins is that your LDL number will go down. That's the desired effect. It turns out that same enzyme also makes this vitally important stuff called CoQ10. And so another effect of statins when you take them, it's not a side effect, it's just an effect, which is a little nuance there, is that your CoQ10 levels will go down. So there are problems associated with low CoQ10 levels, and especially in people who have a predisposition to heart disease. So statins co-administered with CoQ10 is a good idea. And there's sufficient research to support this idea. It's a hard thing to study, but I like to administer coenzyme Q10 when people take statins. That's one example. There's many others. Birth control pills, oral contraceptives, widely consumed, deplete B vitamins and magnesium, well known. And probably that those vitamin and mineral depletions are partly responsible for some of the adverse effects that some people experience when they take oral contraceptives. Take oral contraceptives, take a B vitamin complex with some magnesium in it as well. Proton pump inhibitors, which is like the gastrointestinal drugs like Nexium we talked about, they deplete gastric acid secretion. You need acid to help you digest food, especially minerals and certain vitamins too. So it should be no surprise that if you turn off your acid secretion with a drug that's a proton pump inhibitor like Nexium or any of these other ones, Prilosec, Protonix, all these kinds of drugs, that your gastric acid will go down, and so will your B12 levels, so will your magnesium levels, so will your calcium levels. And if that goes on long enough, you'll wind up with osteoporosis or other problems related to deficiencies of those compounds. And so there is another case of a drug-induced nutrient depletion, and there are long lists of more and more of these.
I I wonder why it is not included, like, when they give you the form about the medicine that you're taking and they list possible side effects, like, it would be so easy just to add to that paper, like, "Hey, you may feel better if you took or, looked into these supplements." Like,
Yeah,
and I think part of the problem is that most mainstream medicine practitioners have not been fully trained in those sort of things. And I do have hope that, as you mentioned, the changes that have happened over the last 25 years or more are leading people in a direction to be able to do that. Because I was super impressed when I took my youngest, who has ADHD and autism, to the pediatrician, and he got his ADHD diagnosis for the first time. The first thing that the doctor said to me was, he needs to be on fish oil. Like,
mm,
and I was like, he is. Thank you. I'm really happy that you knew that.
yeah,
So I do think that people are learning, but it was definitely not the case 10, 20 years ago for
yeah.
sure.
Absolutely, and there is movement in that direction. I've seen, with this evolution, even though it comes with some pitfalls, I think there is also a lot of growth and a lot more openness, and then even some, and for better or for worse, even some attention on the pharmaceutical side, as these things become, some of the combination drugs, by the way, like, include natural stuff, like, there's a Fosamax, which is a osteoporosis drug that includes vitamin D, right? That's an interesting kinda like, dipping their toe into the pond of natural medicine. And then there's another drug, you may be aware of this one. Have you heard of a drug called Deplin before? Deplin, you have heard of what Deplin actually is, I'm sure, because I know your background a little bit, which is activated folic acid. Deplin is a drug, a pharmaceutical, and it's activated folate, and it's useful for people who have mutations in folic acid genetics, MTHFR, etc. But what is Deplin used for? So Deplin is a drug that's prescribed for people who take SSRIs, which are selective serotonin reuptake inhibitors, used widely for anxiety and depression, and it makes the drugs work better. Activated folate makes SSRIs work better. And you don't need to take it as a drug form. It's readily available over the counter. And so
I
very
was gonna
often
say, how is that different than
it's not. Yeah. Yeah.
Okay.
Yeah. It's silly, right? It's like,
That's
prescription
why I
version.
don't know what the prescription is.
Yeah. Exactly, yeah, so,
Yeah.
it doesn't need to be prescribed by a psychiatrist, and there can be there we don't need to get into folate methylation chemistry here, but, like, there can be some subtle differences in the long names of these various different forms of folic acid, but as long as they're activated folates, then they'll work in a person who's unable to activate folate themselves, and so, yeah, so that's just another example of that kinda crossover, cross-pollination happening between drug world and the natural medicine world.
I want to dig into a little bit. You mentioned statins, and I immediately think of my father who occasionally listens to podcasts. FYI, he might be listening. Who I bravely had a conversation with a few years ago when he told me that he was on statins. And I was like, have you looked into improving your omega-3 ratio? Right. Like, my father is a conventional food eater. So, where I get a anaphylactic reaction to gluten and celiac on my mom's side, my dad doesn't have issues with those things that he's aware of. And so he fully, is a kind of traditional lifestyle person, but he's almost 70 and he's super active. He is just like incredibly healthy. And it would took a lot for me to be like, "Have you considered?" And he told me that he was taking like an over the counter fish oil supplement. And I recommended a different brand to him because I was like, fish oil could be really sensitive and it can oxidize pretty easily. Tried this one, and it was interesting. I didn't even know that he had ordered it, and then he, like, let me know, like, 6 months later, he went back in to check his blood work, and it had changed so drastically in that 6 months that he no longer needed the statin, is what he told me, but he was gonna stay on it anyway to be preventative. But I just was, like, amazed in his story that he lives a very traditional, though active lifestyle, that he could see such positive results from kind of like bringing in something like that. And I think this is like one of the areas that I get super frustrated by because there's this classic talk track of outdated information that a lot of people get stuck in. And it focuses only on, like food being a problem. Like, one of my children has high cholesterol and it is genetic for them. It is not related to the foods that they're eating. They're also on a bunch of different medication. They don't sleep well. They have high stress, like all of these kinds of things. And so when I see it, I'm like, yeah, that's basically an inflammation marker. That's what that is. And yet, most doctors tell people who have high cholesterol that, and they're not a nutritionist, they do not have background in this, that they need to change what they're eating. Instead of saying, like, let's talk about your genetics, let's talk about your environment, let's talk about your lifestyle, because all of those things can have an impact on food as well. It's like that's the only advice that they're given. And nobody understands or is told that our body is creating cholesterol in much higher amount than in the foods that we eat. So while, avoiding inflammatory foods or foods that would be high in cholesterol could have an impact, sometimes it's like I think of it as taking a teaspoon of water out of a pool. Like, it's not really going to affect much. And so, seeing that adding omega-3 to my father's lifestyle and the improvement that it had, or different kind of elements in people that I've talked to about stress or sleep or these kinds of things finally moving the dial for them. I'm wondering if we can talk about like inflammation being a driver for this, and where is the line in the patients that you work with on where statins become a worthwhile effort? Because the other thing that I know about statins is that it increases risk of reducing brain health and different kinds of things because our bodies need those healthy fats in other areas. Sorry, that was a
Yeah,
big
it's
long soapbox. I feel passionately about this.
I can tell. No, I can tell. And like, I hope your dad's here. Hi, dad, by the way.
Hi. Hi, Ron.
Yeah. Because good job following your daughter's loving advice. And I'm glad that worked out. It's an interesting story. Fish oil omega-3s, tend to have a bigger effect on triglyceride numbers than they do on LDL and HDL numbers. But it sounds like for whatever reason, he's doing better and not requiring a drug. That's great. And I think so. Yeah, let's talk about this. So the way I like to frame this conversation is by starting with the realities on the ground. And the realities on the ground are what we're really talking about here is heart disease, right? And heart disease remains the number one cause of death by a long shot in this country. It's by far the number one cause of death. And the second and third causes are way after that. So that's important. The other thing about heart disease that's important to know is that it doesn't have the same kind of presenting signs. We talk about presenting symptoms or signs, right? When someone's developing diabetes, they might feel extreme thirst or they might urinate a lot. Those are symptoms of the onset of diabetes. When someone has cancer or something, they might feel a lump or they might feel, get anemic or something like that. These are presenting symptoms that lead a person to go to the doctor, get checked out, find a diagnosis. The most common presenting symptom of heart disease is this troubling symptom that's called sudden death, right? And I hate to be dramatic, but that's what it is, right? And so you don't know you
Listeners
have it.
can't see that I just my face just dropped. Like I'm
You're
like,
just like,
it's a symptom. Okay.
yeah, that's a troubling symptom indeed, right? Like it just, you're fine and then you're not fine, right? And yeah, sorry if I made you snort your water out your nose there, but it's true, right? And so the reason why I mention that is because of those two things, it being a very common problem and often killing a person before they ever knew they had it. We, the American healthcare, the global healthcare system, has invested heavily into understanding who is going to get that problem. So, with good intentions, so that we can prevent it, right? Like that's the most important thing. If you have a very common problem that kills you before you even know you had it, it's a really good idea to invest heavily into understanding who's going to get that problem so you can understand who those people might be and then try to understand what you can do to prevent it from happening. And over the course of the last many decades, we've begun to understand this actually pretty well. Like the first thing that we understood was that it seemed like this problem happened to men more than women. It seemed like this problem happened to people who smoked a lot, right? We understood that early. It seemed like this problem happened more to people who were obese than people who weren't. It seemed like this problem happened to people who had blood pressure that was elevated versus not. Then we understood total cholesterol seemed to be a risk factor. Then we got more detailed and understood that low HDL was a risk factor and elevated LDL was a risk factor and on. And over the years, we've added more and more information to this big compendium of risk factors in an attempt to classify who a person is at risk and then act on that and try to reverse whatever factors are reversible. Some of them are and some of them aren't. Some of them are in our control. Some of them are outside of our control. Some of them a patient might be willing to address. Other ones they might not. But that's the whole idea, right? Is like to classify risk. And it turns out that like when you're doing that, these kind of like hard data points, like blood pressure, for example, or LDL cholesterol, they're like much easier to measure and they're much easier to act upon with pharmaceutical interventions, right? And so it's like, oh, your blood pressure is like 180 over 100. That's bad. We can give you any number of different pharmaceuticals and lower that number down. And then we can measure in a research context, what effect that had on your coronary vascular risk in order, hopefully, to prevent death. That's really what this is all about. And I think that what happens in a case like your father's and in cases of millions and millions of people across this country and the world is that we hyper focus on those hard numbers like that and kind of lose or blur our focus on the overall risk factor package because there's many things that aren't so easily measurable that contribute to coronary vascular risk. Like I said, genetics and dietary patterns and stuff. And so what I like to do when a patient comes in with elevated coronary vascular risk, maybe they have a family history or maybe they smoke cigarettes or smoked cigarettes for a long time or something, is try to do whatever we can do to optimize their risk factor profile, that whole package. And that may or may not include, direct targeting on some of those specific parameters like blood pressure, LDL, HDL, ApoB, lipoprotein A, the list goes on and on. Anyway, that was a long way of describing a kind of I guess what I call a holistic or comprehensive approach to the prevention of heart disease.
Someone wants to be on statins because, as you say, the risk is high and that the risk without symptoms other than it being a really dramatic scare factor comes up for them. What would you recommend as supporting, for example, brain health or combating some of the effects and side effects of a statin?
Yeah, great. It's a great question. So they're commonly used drugs. They do have a place, and there's a lot of research that supports their use when they're used appropriately. And so we mentioned it already in our discussion about drug nutrient depletions, that probably the single most important thing is coenzyme Q10. And I would also say, maybe even I said the single most important thing. I think the most important thing is doing what a person is willing and able to do to minimize their cardiovascular risk across all those patterns, right? Including their cholesterol, but not with this hyper or laser focus on just cholesterol, but improving their overall risk factor profile, stress management, sleep, good nutritious food, healthy physical activity patterns, mindfulness, stress management, et cetera. And then hopefully, and like I said, when people are willing or able, right? So do what you can do, understanding the risks, educate oneself about those risks, and then act on them to the extent that you're able. And then, if you need to bring in a statin or if that makes you feel more comfortable, there's a common use case for statins. It doesn't sound like your father's in this category, but a lot of people want to continue their fast food eating, unhealthy food behaviors and just use a statin to offset the risk associated with that, right? It's like a get out of jail free card. Oh, I can still eat whatever I want. I just take this, my cholesterol's down. It turns out that like poor dietary patterns are still a risk factor, even if your cholesterol's down, right? So like that's what I'm talking about, looking at the whole risk. It's like even though you have a good cholesterol numbers on your lipid panel because you take Crestor or Lipitor or whatever, it's still not a good idea to eat like a whole bunch of donuts for breakfast, right? Like it still contributes to risk, even though it might not show that in your lipid panel. So anyway, I'm encouraging people to try to understand that whole risk factor package. And then if they wind up on a drug for whatever reason, I always suggest that they add CoQ10 to that regimen. That's the fundamental sort of drug nutrient support.
Good to know. The other one that I want to dive a little bit into, and then we'll close out with a fun question,
Mm.
which is selfish in nature. The other one that I hear often is about biotin and thyroid. So I myself have thyroid disease. A lot of listeners have autoimmune and often thyroid associated with that. And I love that you shared a video talking about biotin being something that people need to be aware of as affecting thyroid test results. I I wasn't necessarily aware of this. I manage mine with lifestyle, and so I'm not getting testing regularly to like be aware of that. But I was recommending for people who have hair loss, which people with thyroid disorders often experience hair loss. I've had COVID so many times, but I had long COVID and kind of getting through that, I had a lot of shedding in my
Mm.
hair. And so I was using a topical biotin product, among other things. There's CBD and different kinds of things in the product that I was using. And so I was sharing on social about the positive results that I was having with this. And I got questions about the biotin affecting thyroid levels when it's used topically and not just as a supplement. And so I did some of my own research and I found that it can, in fact, cross the blood barrier, which is a good thing. That's why we're seeing results from products that have biotin in them topically because it's an internal and an external solution. But then if someone were getting thyroid testing done and they're using a topical product to solve one of the symptoms of that issue, it's kind of creating this catch 22. So one of the, things that I found, and I'm curious if this is anything you've looked into, is that if you're taking a supplement of any kind with biotin, that whether it's ingested or topical, discontinuing that 48 to 72 hours before testing will allow positive, normal test results of the thyroid because biotin is water soluble. It'll leave the system. Do you find that would be the case? Or do you think that the thyroid would still have lingering effects from that? Or have any thoughts in general about
Yeah.
like this topical, because if people might not even be realizing that's something that's in their shampoo, for
Yeah,
example.
yeah, absolutely. I think that there's a lot of people who are out there who are either inappropriately medicated, maybe too much, maybe too little because of this problem, both oral and topical. I think oral biotin supplementation is more common. Topical is becoming increasingly common as we've learned that you can get some of it through the skin and into the bloodstream. And to be clear, It's really interesting, actually. The biotin in the bloodstream has very little to do, if anything, with thyroid function per se, right? It's not actually affecting the thyroid or the pituitary gland or the thyroid metabolism. What it's doing is affecting the test, right? So when you think about this, right, so you take blood out of someone's vein and put it in a machine. And these are some pretty fancy machines at those labs that are testing things like TSH, thyroid stimulating hormone, or T3 or T4. There's a whole bunch of other tests that we do, like things like cholesterol and sodium. And there's a million laboratory tests you can get done. And those tests are really fancy. That's like the work of laboratory chemists. And it's kind of amazing if you dive deep into that world to see the complexities that are involved in testing the level of thyroid stimulating hormone in somebody's blood, right? It's not an easy thing to do. And it turns out that the TSH test and several of the other thyroid tests depend on laboratory technology that involves biotin, right? It's part of the machinery of the test. They use biotin to bind something. I don't know the details of it, but it binds something and then they see if the color changes or this sort of stuff, right? And then it's used in the measuring process. And so if there's extra biotin loaded into the blood from supplementation, it basically interferes with the accuracy of the test. It's not interfering with the thyroid gland, it's interfering with the testing. And that can cause the TSH to be high or the TSH to be low or the free T4 or total T3 levels to be altered. And that it interferes with medical decision making, right? If your TSH is really high, the doctor's going to tell you you have hypothyroidism and you need medicine or you need to do something about this. And so so that's what's happening there. It's a really interesting phenomenon. And I'm certain, and the laboratory data suggests this is true, that there are lots and lots of people who are inappropriately medicated with thyroid hormone, either too high, too low, not enough, too much, because of this problem. And so, yes, the advice, whether it's topical or oral supplementation of biotin, is to discontinue the use completely. I give 72 hours before your blood is drawn. That will bring your biotin levels back down to normal, and hope there still will be some biotin in the bloodstream, but that the laboratory technology is calibrated for that, and that should give you accurate thyroid lab testing value. So stop your biotin topicals or oral supplements 3 days before you get your blood drawn.
Thank you for that validation and the explanation, which is fascinating. I also just want to clarify for people, correct me if I'm wrong, but biotin would be found in B complex supplements, in a lot of multivitamins, in potentially if someone's taking like a collagen supplement, anything like that, it might be added to it. So definitely check the labels of the supplements that you're ingesting, and then any product that you're using that's marketed for like hair, skin, nails, it could potentially have biotin in it because it is a great vitamin. Yes, it's a vitamin. I was like, is it a mineral? It's a vitamin for that health support. But the problem is if you're getting your thyroid tested, it could
Yep,
the test
absolutely.
would
And
show
it's
flames.
it's
So
widely found in multis. And yes, you're right. Hair, skin, and nails formulas. I'd be shocked to find a hair, skin, and nails formula that didn't include
yeah.
biotin. And yeah, absolutely. Biotin's totally great stuff. It just interferes with thyroid lab tests. That, that's all. Yeah.
Great. So people who have thyroid issues do not need to avoid it. You just need to be aware before you get your blood drawn.
Yeah.
Okay, great. So the last one that I have is totally selfish on my end because I grew up with my grandparents and my parents telling me constantly to not crack my knuckles because I was going to get arthritis. Can you have a video talking about that being a scare tactic and not being supported by science? And I just want you to share with the class because I was so relieved to hear you say it and wondering if you could shine more light on that.
Yeah, totally. It's totally a scare tactic. And we're cut from the same cloth again here. I'm a knuckle cracker myself. I'm proud about it. There's this funny thing. I'll talk about the knuckle cracking, I promise. But there's this other related thing that everybody's heard of too, another scare tactic thing that I learned about recently, which is don't swim after you eat. Have you ever heard that before? Right? Like it's a common thing. Like
Like
parents,
every summer, every day.
yeah,
Yes.
totally, right? Like, don't swim after you eat. Like, it's dangerous. Like, the idea is that, like, maybe you could drown or something, or like the blood's going to rush into your stomach and like then you wouldn't be able to swim as well or something, right? So, like, total scare tactic. And the reason why people say not to swim after you eat is because the kids at the beach or at the pool, they eat fast and then they want to go swimming, and the parents still want to hang out and like eat the barbecue and like drink a beer or whatever, and they don't want to go watch the kids and lifeguard them because they're not done eating yet. So they told the kids, don't swim after you eat. It's dangerous. You have to wait at least a half an hour. There's no truth to that at all. It's
I always
complete.
thought it was because they didn't want the kids throwing up in the pool, right?
Yeah,
Like
right. So that's
if it
another reason.
yeah.
Totally. That's also true. Yes. That's not, it's actually not true. I don't think it really increases the risk, but that was the idea. Like you could throw up in the pool and then they'll have to close the pool. So yes, add that to the list of fake reasons why you're not supposed to swim after you eat. But the real reason is that the parents just didn't want to go watch the kids in the pool. They wanted to continue eating at a leisurely pace on a summer beach day rather than go watch the kids. So with that in mind, yeah, knuckle cracking. I'm not sure there was like some nefarious reason why people came up with this, other than the fact that knuckle cracking annoys a lot of people. Like it makes people like, skeeves people out. They hate the sound. They don't want people to do it. But indeed, there is no evidence that knuckle cracking, even very frequent knuckle cracking, increases the risk of arthritis. It might increase the length of ligaments across the involved joints, maybe loosening them a little bit, but it's just not a risky thing to do. There's no evidence that it increases the risk of joint disease of any sort. And there's been a number of interesting studies about this. The most interesting of which was a doctor himself who was told this is many years ago, who decided, gosh, what a scientist this guy was, to just crack the knuckles on one of his hands for his entire life. Like he did this for like 50 years. And then at the end of those 50 years, did x-rays of the left hand, which was cracked like 3 times a day religiously, and the right hand, which was never cracked. And they were basically identical.
I don't know how he could have physically done that like
I
that.
know.
Because you relieve for me, it relieves tension, right? And so,
Yeah.
like, to be able to, like, relieve tension on one side, but not the other. But yeah, kudos to that scientist for
Yeah, yeah.
pushing
I thought the
through.
same thing. I'm like, gosh, that would drive me kind of nuts. Like I need to like equalize it. I'm going to crack this thumb. I got to crack that thumb. Just kind of feel balanced.
There must be something going around TikTok because my 13-year-old brought it up to me. Like, sometimes we're sitting and snuggling, it's like a sign of affection that we'll crack each other's toes, right? Like, and so
Mm.
he went to go crack my toes and they didn't crack. And he's like, Mom, you have a vascular issue. There should always be air between your bones. It's like, what are you talking about? So he's like, I saw it on TikTok. I'm like,
Yeah.
okay, I don't know where
Wow.
that's
Yeah.
going.
I
Yeah.
love that sign of affection too. I'm a big, like I say, a big knuckle cracker, and I've done a lot of physical medicine in my professional work too. So I'll go around and like pull on my kids' toes. Sometimes
Yeah.
you get the click, sometimes you don't. If you
Yeah.
don't get the click, you don't need to worry about that.
Yeah. It's like I told him, I was like, I don't know where you're getting your information, but
I might
that's
have to
fine.
weigh in on this. I may have to weigh in on this one on TikTok soon.
Yeah, there you go. Find the source video.
Yeah.
Okay, so thank you so much for helping bust all of these myths and diving deep into this. Really appreciate your time and willingness to go there. One of the things that I always try to leave listeners with is this actionable step that they can take to improve their life. So I know I've talked a lot about different kinds of supplementation and things to be aware of as it relates to inclusivity and access. Is there something that you can think of top of mind that would be like the number, one, two, or three things that people can, after they've listened to this podcast, not feel overwhelmed, like, oh, I need to do all the things, I need to take all the supplements, but just like do this thing
Yeah.
and you will, feel better or it will help you in some way.
100%. It's a great question because so many of those hot tips are like, take this supplement or buy this expensive thing, or even eat organic food or something, which is not accessible to everybody, especially those who live in food deserts who don't have the money to afford such things. And I would like to say it here first that natural medicine doesn't need to be expensive, and it really ought to be medicine for all people in a very down to earth way. So, with that in mind, that inclusivity and access in mind, yeah, there's a few things I can think of. I'll give you three. The first one is like, I'm going to use a Latin word, and the word is docere. And docere is a naturopathic principle, and it's the Latin word for doctor, and it means teacher. And so I think that we can all be our own doctors by educating ourselves. And teaching, I think, is one of the foundational things, learning about ourselves, about the world that we live in, about the sorts of things that we're talking about now. And there's so much empowerment that can come from education. And I think, yes, there are issues in our education system around inclusivity and access. That's to be sure. But I do think that there's opportunity for everyone to learn more about how their body works, learn more about how food and nutrition, et cetera, impacts their bodies, things like exposures and whatnot. So I think being your own docere, being your own doctor as teacher is a really important tool in the road to better health for that's accessible to everybody.
Kind
So
of
that
a
would be
little asterisk there and say, make sure that your teacher is an actual teacher and not, an Instagram influencer.
yeah, sure.
Like, I just, 100% agree with you. And at the same time, I was thinking back to our earlier conversation about people claiming that you need to do all these other things, right? Instead of just the basics of
Yeah.
learning about ourselves.
Yes, you're 100% right about that, and I was referring to that a person being oneself being one's own teacher, and certainly there are accessible teachers out there. I did not want to plug anything, but like, hey, we're talking about it. Follow me on Instagram. Like why not? Right? Perfect opportunity. I'll tell you the real deal right there. And so, yeah, so yes, trustworthy teachers in the medical professional world. And it's true that credentials don't always equal credibility. And I think the internet has broken down a lot of those kinds of barriers. But yes, there's a lot of misinformation on the internet. You got to be careful who you trust out there. So that was number one, education. And number two, in a very different way, is boundaries. And I think that like there's this adage that you've heard before that like good fences make good neighbors, good training is helpful for animals. I know you're an animal owner and lover, and so am I. And boundaries around one's life. And this applies in so many different ways. It applies to people, it applies to toxins that we expose to, including toxic people. It applies to food and nutrition, what we don't do in terms of what we consume. It applies to physical activity and fitness. Like establishing boundaries is something that doesn't cost any money. It's something that anybody can do. And putting good boundaries around your diet, your lifestyle, the people, the toxins, the exposures, and is really good practice. And I think foundational natural medicine stuff that's available to anybody and doesn't cost a thing. So that would be number two is setting up boundaries. And those are good boundaries and boundaries around things that you do and boundaries around things that you don't do. So that'd be my number two. And then number three, this is just an awesome one in the true sense of the word. So there was some research about inflammation. So we've known for a long time that like positive emotions are correlated with positive health and negative emotions are correlated with negative health. Like negative emotions like anger and frustration, jealousy, these kinds of things are correlated with negative health outcomes, and positive emotions, joy, love, contentment, etc., are associated with good or better health outcomes. So the question, this was at Berkeley several years ago, was which positive emotions or which positive emotion is the most strongly correlated with lower levels of inflammation or inflammatory markers in the blood. In this case, they were looking at interleukin 6, an inflammatory marker in the bloodstream. And so they did a study, and the study concluded that the positive emotion that was most strongly correlated with low IL-6 levels, lower levels of inflammation, was awe, AWE. And so I love that because, first of all, I'm an old surfer and I like to say awesome all the time, like in the kind of surfy kind of way. But also, awe is one of those things that is accessible to all of us as well, right? Whether it's awe in your own body, in your family, in your home, in nature, in your animals, in technology, there's opportunities to appreciate awe everywhere. And if you just take a brief moment to think like how amazing it is that you and I can talk at a great distance over this technology platform in this way, or whatever the case may be, the beautiful mountain that you might see, or the how your dog is amazing, or your cat, or your child, or the food, or how beautiful that orange is when you slice it open and look at the inside of it. Those are all opportunities to appreciate and experience awe. And if you do that regularly and make that a practice, it's the research shows that will correlate with lower levels of inflammation. So yeah, find awesomeness every day, a few times a day is my number three.
I love that. And I love an excuse to watch the sunset or go check out the stars. Those are things that give me off. I'm just think about in the scheme of the universe, we're not even a grain of sand on the beach. And like the awe, what is around us and, all of those things. So that resonates with me. I appreciate that perspective. I
Yeah.
am going to look into that study because I totally geeked out on the happiness study that was done. I had a podcast with Kathy Heller and she introduced me to that one that was done by, I think it was through Harvard. And so now I'm like, oh, I'm going to go check out this emotional study. I love the intersection of mental wellness with physical wellness and I hope that someday we will stop talking about them as two different things
Yeah,
because
absolutely. That is a
they're
s that
so
in your world about spectrums, right? Like,
yes.
I love this line one time one autism researcher said, like, that the autism spectrum is long and deep, and we're all on it somewhere, right? Like, it's kind of a beautiful thing. And I think yeah, sort of similarly, right? The mind and the body, like, I remember in school, I took a class, and it was called psychoneuroimmunology. Psycho for psychology, neuro for neurology, and then immune for immunology. And then, like, I think a couple years later, it was called like psychoneuroimmunoendocrinology, adding in that like hormonal,
Mhm.
function and endocrinology is part of that. And it's sort of like ridiculous. Like this could just become like the longest course title ever because duh, it's all
Everything.
connected. Right?
Yes.
Like, right.
They're just gonna change the past. Everything's
Yeah,
connected. Yes.
exactly. Yeah. Yeah.
Listeners, I want to thank you so much for tuning in today. If you'd like to keep in touch, we have a link in the show notes that you can find Dr. Josh Levitt on Instagram and at the same handle on TikTok. I don't know who's on TikTok. It's not me. It's definitely my kids, but it sounds like you could definitely find Dr. Josh there. Maybe he'll tackle vascular issues with knuckle cracking in the future, but there's lots of information there. I just pulled a few of your videos, but there's tons and tons there for people to find more information and myths that you're busting. And you can also find everything that you might want to find at upwellness.com. I'm sure links to your socials and all the other things that you do and projects that, you and your business and all of those things are at upwellness.com. And we also will put a list of resources into the show notes for you. So I pulled the JAMA study that you talked about earlier, and I'm going to go research this study as well. And I'll put those links in the show notes for you listeners. And remember that you can head to patreon.com/the whole view to get all of our shows delivered to your inbox ad free, which is a really great way to support the show that we create and produce ourselves. And I am sincerely asking that if you enjoyed the show, can you just take 2 minutes to leave a review? Cut point. That's our first cut point of the whole show. If you enjoyed the show, can you leave a review saying so? It costs you nothing except about 30 seconds of your time, but will make a huge difference in my being able to continue to do this work and reaching people who need to or would want to find more information about the topics that we cover here. So don't forget to follow or subscribe in the podcast app that you're using as well. And as always, I appreciate your willingness to be open to grow through your own personal change. No one is perfect, but in listening, learning, and unlearning, we can choose to become better versions of ourselves for ourselves. Thank you, Dr. Josh, for being here with us. Any final words?
Thank you so much. And thanks to your listeners. I hope this was an inspiring and motivating conversation for all of you. Thank you again.
Absolutely.